people to speak to you today, including Dr. Linda Bell, Dr. David Cole, Dr. Stephen Shelton, and Stephen White of DHEC. I'll start off with some comments on several points. The first is these are all important issues. And as you know, our state Supreme Court has issued a decision some time ago concerning the CARES Act funds. Obviously, I'm very disappointed with the decision. We had a rehearing, and still we were disappointed with that decision as well. Most importantly, I'm disappointed for the 5,000 or so students from working in low-income families who will be denied any financial aid from the CARES Act through the SAFES grant program that we initiated. That was $32 million. Many of these parents are barely able to scrimp and save enough money to pay for their child's tuition in independent Christian and other private schools. They do it to provide the type of education, environment, and instruction that they feel best suits the child's unique needs, and there are a lot of those. During this pandemic, with so much uncertainty and anxiety facing families, a child's displacement from the school they love and thrive at could have devastating consequences to their learning and emotional progress. I'm also disappointed that because of this decision, our independent and private colleges, including the historically black colleges and universities, will, as a result of this decision, be unable to access the CARES Act relief funds. I hope that this question can be resolved in some manner and resolved soon, perhaps by legal action by those institutions. I'd like to point out that it has been a common practice over the years for the General Assembly to appropriate money to benefit students at private and independent and Christian schools and colleges in South Carolina. And this includes need-based grants and financial aid, as well as scholarships funded with revenue from the state lottery. We do have a contingency plan for repurposing the CARES Act funds. They will be directed at providing educational opportunity, choice, and access for students from working and lower income families who have been adversely impacted or displaced due to the COVID pandemic. As to schools, South Carolina must have an educated and trained workforce to compete for jobs and investment. And the competition for jobs and investment in the southeastern part of the country is going to be fierce as it was before the pandemic hit. And this will go on into the future. We cannot afford to keep schools closed at all any longer. We can't afford it for as long as we've had them closed. In July, I called on all the public school districts to give parents the option to send their children back to school in person 5 days a week, or the option to choose virtual instructions. Some schools did it, most did not. To keep classrooms open and safe, I directed the Department of Administration to provide personal protective equipment for every school district that requested it. This was months ago. We have repeatedly offered to provide whatever personal protective equipment any of the school districts wanted. And Kim Stinson is here with the Emergency Management Division. We have millions of gloves, masks, all of that, and it has not been requested. There's a lot available now on the commercial market, but there's no reason for these schools not to be opening if what they need is personal protective equipment, because we have an abundance of it. Over $10 million in PPE was shipped out this fall in response to my offer. School districts in our state have also received over $400 million in CARES Act funds to help bring the students back to the classroom. 2 weeks ago, I directed the Department of Health and Environmental Control to provide every school district with COVID-19 rapid tests. Those are the BINEX tests. For many South Carolina families, schools provide the only opportunity for parents to go to work. The only opportunity. Many working parents cannot stay home with their children every day. They must go to work to pay the bills and provide for their families. Parents should not have to choose between their child or their job. But that is what the decision of the school districts who have not gone back to 5-day face-to-face education are requiring these parents to do. And it is not the right thing to do. In October, my office surveyed the 15 school districts that started the year providing in-person instruction. That's 15 school districts out of 79 that started the year with in-person instruction. This was done to learn what practices and policies were working, which ones were not, and what, if any, additional support was needed to ensure the continued safety of the students, teachers, and staff. The answer was continuous communication with teachers, staff, and parents across numerous media platforms allowed these districts to adapt and evolve their health and safety policies and procedures in order to keep the students in the classrooms. The students, the parents, the teachers, the districts were communicating, collaborating, and cooperating, and they've opened safely, and they've been doing just fine. And also in our private school system, independent school system that serves approximately 50,000 students, they have, I believe 99% of them have been open 5 days and have had very few, if any, problems. This week, I sent a notice of upcoming results of this survey to every school district superintendent in the state and encourage them to share the survey with their local school board members. It is my hope that this information will help them provide to parents the option of 5-day in-person classroom instruction. The survey is available now at accelerate.sc.gov. Ladies and gentlemen, there's very little that I can do to open these schools that we have not done. I do not have the authority to make the school districts make that decision. I cannot do it because I do not have the authority. Had I the authority, I would have done it a long time ago. But there's ample personal protective equipment. There are ample procedures and policies that have been used successfully. These children not being in school are having enormous unintended consequences. People all over our state are going back to work. We have a 4.2% unemployment rate. People are working. There's no reason for these schools not to be open. The consequences of these children, some of whom were marginal in their learning to begin with, the consequences are going to be enormous, and we cannot afford that. We've got enormous competition, fierce competition, economic. We've got to educate our people for the skills, the education, the things that they need for the future if our future is going to be bright. Across the nation and in South Carolina, infections and hospitalizations are rising. It appears that many people have let their guard down. I know we have fatigue from all the things that we need to do, but now is not the time for us to let up. Now is the time for us to redouble our efforts. When the cold weather comes, people go inside with the windows shut, with a lack of circulation, and that's where this virus spreads. That's when people when they're close together in various settings, that is the best opportunity for this virus to spread. So that is here, that is upon us now, but we know what to do. We have learned over the months, we've heard repeatedly from this podium as well as others around the country what we need to do. What we need to do now is determine that we're going to follow those best practices and keep the spread of this virus down. Wearing a mask when social distancing is not possible. Washing your hands routinely. Being courteous to others, courteous to your family members, courteous to visitors, courteous to your customers. Go outside, get fresh air, keep your windows open, but follow those rules that have been stated so often that we've all memorized them by now. Following successful procedures and protocols has allowed our schools, businesses, restaurants, manufacturers, and our state government to operate safely and securely. Again, we need to redouble our efforts. Vaccine. This month, the Department of Health and Environmental Control will begin receiving the vaccine this month, December. It is estimated that our state's first allotment will be between 200 and 300,000 doses. I want to caution everyone, this will not be a fast process. I want to caution everyone, this will be a slow process all over the country. Most South Carolinians will not be vaccinated for months. So we've got to keep our guard up. Now is not the time to let our guard down. There are different phases or steps in this process of delivering the vaccine. The first step, the first phase, called Phase 1A by the CDC, to receive the vaccine will be the workers or individuals in healthcare settings that are at the highest risk of contracting COVID-19 and are essential to preventing mortality of others. Some examples are, and there are a lot of them, I'll read them slowly, but these are the example of the first group that will be receiving the vaccine in South Carolina and elsewhere according to the CDC rules, regulations, and recommendations. The first group will be, and there won't be enough of the vaccine for all of these, as you understand, physicians, physicians' assistants, nurses, nurses' aides, physical therapists, respiratory therapists, speech pathologists, medical students, nursing home and long-term care facility residents and staff. Also, medical personnel in correctional facilities, jails, and detention centers. Also, this is Phase 1A, the first step, medical emergency first responders such as EMTs, paramedics, fire, and law enforcement personnel. I hope that was slow enough for everybody to get it. Also, home health and hospice workers. Those will be in the first group. The next group will be workers or individuals who provide services and which have a high risk of exposure due to interactions with the public. Examples include, again, I will read them slowly. The remaining first responders, including fire and law enforcement personnel that don't have face-to-face contact in emergency situations with the public. Workers in jobs that provide critical services such as utilities workers, water, trash, transportation, waste removal. That includes bus drivers, Department of Transportation workers, and others. Also, in this second phase, agribusiness and food production workers. We have to keep those providing the food for the rest of us. And those will be in processing plants, canning facilities, and others involved in food production. Persons who live or work in congregate settings like group homes, homeless shelters, correctional facilities, jails, and detention centers. Also, in this is Phase 1B under the CCC's statement. I would call it the second step, a second group. This continues to include people aged 75 or older and persons with 2 or more of the following risk health conditions. These following conditions: cancer not in remission, chronic kidney disease, COPD, diabetes, disability, heart disease, HIV/AIDS, obesity, pregnancy, and sickle cell disease. 2 or more of those. The next group, Phase 2 it's called, includes this: pharmacists and pharmacy technicians, grocery store, food service and food delivery workers, service industry workers, postal workers, public transit workers, K-12 school teachers and school staff, child care workers and staff, school bus drivers. Are you getting all this, Ms. Burkett? Okay. Instructors and staff at higher education institutions, including 4-year colleges, technical colleges, and research universities, and persons age 65 or older, and finally, persons with one of the following health risk conditions. And you heard these a moment ago: cancer, chronic kidney disease, COPD, diabetes, disability, heart disease, HIV/AIDS, obesity, pregnancy, sickle cell disease, asthma, cerebrovascular disease, good gracious, corticosteroid. How you say that? Corticosteroid. That's it. Cystic fibrosis, hypertension, immunocompromise, liver disease, and pulmonary fibrosis. So that's a little longer than the first list. But you have to just have one of those. The final phase will make the vaccine available to the entire population, which includes the vast majority of the population. But again, what we have to remember is that this is going to be a slow process. Now, we have worked on our distribution system for the vaccine for some time. We are confident that among DHEC, the EMD, and the National Guard, it will work, and we're ready to do it. But we urge everybody to have patience and want to remind everyone that even though the vaccine is coming, that we've got a long way to go before we have managed our way out of beyond this virus. So I urge everybody again to remember those simple things that you're supposed to do. Wash your hands, keep your hands away from your face, you pick things up from things you touch, wear that mask, keep your social distance, and try to get as much fresh air and stay outside as much as you can. With that, I'll turn the program over to Dr. Linda Bell from DHEC. Doctor?
Thank you, Governor. And I appreciate being here with my colleagues and others who are here to help address what more we can do to stop the spread of COVID in South Carolina. Because this has been an extremely difficult year. So many illnesses, so many lives lost, and very unfortunately, we're not near the end of this. And in fact, over 239,000 probable or confirmed cases have been reported among South Carolinians, and 4,500 people have died from COVID in South Carolina. So with the recent news of the promise of the vaccine trials, this gives us great hope. But as the governor has commented on, it's going to be quite some time before we will realize the promise of having significant coverage for the majority of our population in South Carolina that would allow us to stop the prevention measures that we're recommending that are very effective. And our case numbers here in South Carolina have reached an unprecedented level, here in South Carolina as well as in the country as a whole. Our data points are worsening, unfortunately. So when we look back at just a little over a month ago, when 35 of our 46 counties were in a trajectory that for at least 1 to 6 days, they were in a downward trajectory. And now, just a little over a month later, only 6 of our South Carolina counties are in a downward trajectory. And just last week, we reported 2 of the highest days of cases since the pandemic first came to South Carolina. So with more than 13,900 South Carolinians last week alone being reported, that many cases in a single week, it makes this last week the worst it has been for us since the beginning of the pandemic. And nationally, the case counts are rising, hospitalizations, deaths, we're seeing this everywhere, and it's impacting our ability to share resources. It's impacting the ability for healthcare workers to travel from one jurisdiction to another to help, because we are all now pretty uniformly being affected across the country. And these sort of dire statistics are very personal to me, because every possibly preventable death that I hear about, every community member that is at fear of going to work or for fear of sending their children to school, when there is more that we can do to prevent this. And in fact, no one else should have to die from COVID-19, but unfortunately we will see more deaths. But the fact that it is within our power to control a great deal of this with the resources that we have at hand now is something that I implore all of you to pay more attention to. And there are recent projections from the Institute of Health Metrics and Evaluation that tell us what it might look like for us here in South Carolina if we continue to do what we're doing now. And that is by April of 2021, if things don't take a different course, we stand to see an estimated 1,000 deaths. So what that means is that from the end of November until the beginning of April, an additional 3,000 more South Carolinians may die if we don't do something differently. But the good news about this is that in these projections, they also say that if we were able to implement 95% use of masks within a week, that by that time in April, we could actually avert an additional 1,000 deaths. We could avert 1,000 more deaths. And in fact, if we were to do this 95% mask coverage within about 4 to 6 weeks, by the beginning of the next year, we would see a significant difference in our trajectory. So when we look back at what we looked like a month ago and where we look forward to what we could look like a month from now, there is significant control that we have over what we're seeing. And this public health is not about politics. The virus doesn't do its harm or doesn't spare people based on your political beliefs. We have to follow the scientific evidence in making decisions about what we're going to do. And so if we understand that this virus is spread by what comes out of your nose and your mouth, and that could possibly kill you, then if you cover your nose and your mouth, then you can save lives. And this is the level of control that we have over our trajectory in the near future. And the other measures along with mask wearing, the physical distancing, if we understand approximately how far the virus can spread, and we stay that distance away from others, whether they are our family members who we are welcoming into our homes during the holidays, or they're people that you don't know, then you reduce your chance of exposure. And while we're seeing approximately 20% of the people that we test are positive, that tells us that there's a great deal more disease in the community that is currently undiagnosed. So the more people that you gather around, the more you increase your chances of being exposed. So we absolutely need all South Carolinians now to do everything that they can to contribute to controlling the spread of COVID, to change our trajectory. Over the summer, we saw our cases surge after those holidays, and we can't continue to tolerate these surges and these downward trends. So if we take these measures, adopt these measures, and practice them consistently and routinely, we won't see these additional surges. We can get ahead of this pandemic while we wait for the promise of the vaccine. And it is true that we're very excited about the projected effectiveness of these vaccines, but the fact that they will be in limited supply for those who are, initially, for those who are at highest risk of being exposed and highest risk of suffering severe consequences, that it will be some time for significant coverage in the population as a whole. But that time will come. The plans to roll that out are somewhat complex. It involves the distribution plans, making sure that the vaccine is where it needs to be and that people who need the vaccine can get it. But we have in place, we are and can make those complex plans, but simultaneously we have to take the simple steps that are at our disposal. So while we can accomplish these plans, in the meantime, we have to use the measures that are at all of our disposal with the masks, the physical distancing. And I'm excited that we're working with many of our stakeholders to help us make these decisions in the state for the equitable distribution of the vaccine, to make sure that any barriers that may currently exist, particularly for those in rural areas who don't have adequate access to care, and where there aren't currently mechanisms in place for mass vaccination for those who may need it. We're working with our stakeholders to identify where those places need to be, and we're making plans to get the vaccine there. So I just want to end by saying that that I hope we can look back at this point in time right now as our watershed in this pandemic, that it was at this time that we made decisions that resulted in a change of our trajectory and that we did not go back up again. And that in the meantime, while we're waiting on the vaccine and we look forward to the time when there will be ample supply for everybody, there is a great deal more that we can do in the months to come to put us in the best position. So thank you.
Thank you.